Welcome back, everyone. I'm Miss Melanie, and this is Coding with Miss Melanie, Coding Clinic Review for Class 2030 on C&M Glass. Okay, so now we've already reviewed some of our key points with the whole class on abstracting, parts of the notes, and physician query. Let's look at some very specific coding lookup with HCPCS and CPT coding. One of the questions I had a lot this week was, how do I know when I should use a HCPCS book versus the CPT book? So there's a few things that I want to give you as just some guides, and this will apply both to HCPCS coding as well as your future ones. So, number one, who and what are we doing? So this is important in terms of asking yourself, not the note, what are you coding for? Are you coding for the physician or the radiologist? Are you coding a specific preventative test or a specific measurement test? Is your purpose diagnostic or therapeutic? These are all terms that will apply in the next couple of weeks, but also throughout the rest of the term. And of course in your coding career. Specific questions about guidelines. You may have noticed the guidelines are not exactly organized the same as they are in other coding manuals. So while you have a few guidelines in the very beginning of your book, you also have them in each section and sometimes within subsections of your CPT manual and inside of your HCPCS. So for example here, I can go into codes 793, let me read that upside down here. Let's say that I go to 76830 in my CPT book. If you look at that, above this code for ultrasound transvaginal is some non-obstetrical guidelines. And so it's very important that you always look at any guidelines that come in the beginning of a subsection within your CPT manual to see if any of this applies to you before you select your code. Oftentimes this will give you information as far as determining the level of complexity or the care for the patient, and sometimes even more details about when to select a code. Beyond that, you have two other things you want to keep in mind. The golden rule of coding. If it's not documented, it didn't happen. That's really important, guys, because in the insurance business, if they see something that you're billing and you didn't document it properly, it's denied. On our side, for the provider side, if we're trying to support medical necessity and support why we're doing a procedure or that we did it, we want to make sure we're as accurate and precise as possible. On the fraudulent side, it could even come down to legal rules and regulations and penalties with some severe fines if we're not careful. So always make sure that anything you're coding is documented properly or it didn't happen. That brings us to our last key point before we start coding, which is insurance specifics. And this will actually take us into our next part of this segment. With your HCPCS manual, you'll notice there's a couple of codes in here that are very specific to insurance. So if it's G codes, these are specific to Medicare services and Medicare payers. So one of your questions is, who am I billing for? What am I doing? And why are we doing it? So Medicare or CMS. And then your S codes, I had some questions about these this term as well. So if we look at S codes in our HCPCS manual, we'll see at the very beginning it says Medicare and other federal payers do not recognize S codes. However, they may be useful for claims in some private insurers. So it's insurance specific. And often it's used for reporting. So there's a lot of codes, especially in your HCPCS manual or some of your category 2 and 3 that are insurance specific. We only use them if that insurer says that it's okay. How do we know? Well, one of the good things that you'll find if you're in a doctor's office is you have access to each insurance that you are contracted with to look at their fee schedule and see what's allowed and what's not, as well as some specific rules from them on when they allow certain things and based off of what diagnoses. These are things that you'll learn about as you begin your career in the medical world. We'll talk a little bit about that later on in this class as well, utilizing Medicare's rules and guidelines. For now, let's just say it's important to identify who's the insurer and do they have very specific codes that they would like us to use. So let's look at our first example. We're going to code for a PSA. PSA is a laboratory test that you'll be learning about this week. So prostate-specific antigen is what PSA stands for, and oftentimes it's done for two purposes, either diagnostic or screening, okay? Diagnostic means we're looking for something. They either already have a condition that we're checking on and we're trying to see if it's continuing to be a problem, or we're checking to see exactly what level it's at. Screening is saying they don't have a problem yet and we want to just kind of see if it's normal. So a PSA is something very specific to males, and it checks for BPH, which is benign prostatic hyperplasia, which is a common test for men over the age of 50 to check for cancer. Okay, so in our HCPCS codes, we can look under G codes and we'll find under the screening services for prostate-specific antigen, there's one code, G0103. Okay, so we'll write this down here, G0103, and this one is a screening code. Okay, so if you're with a Medicare patient and they are doing a, what are they doing? They're doing a PSA for the purpose of screening, you should be billing the HCPCS code. If, however, you're not billing a Medicare patient or it's not a screening, you'll want to look and see if there's any other codes that would be appropriate. In this case, there's no other screenings here, so we can go to our CPT codes and look for 84152, which I've looked in the back and found under prosthetic or PSA for prostate-specific antigen. There we go. 84152. And you'll actually notice when you get there that there's three different options. And so you have 84152, 84153, and 84154. At that point, it's important to look at the lab and say what kind of test was done, because we know it's not a screening test or it's not a Medicare patient. Okay, so not screening and not Medicare. Then we'll go to the CPT. So our guideline, our rule of thumb is to always go with CPT unless it's Medicare specific or insurance directed, and then look at your options under the HCPCS G codes for Medicare before you pick up any of your screenings for CPT. We'll look at a lot of those this next term. I'm going to give you guys an activity that'll get you on the right track in determining when you're going to look at those G codes and when you're not, and we'll revisit that also in our E&M section. All right, that's all for today for our Coding with Clinic with Miss Melanie segment. There was a few other questions that came up in coding, and if you have some specific ones you want to see on the Coding with Miss Melanie segment, feel free to send them to me and I'll be happy to review that. For now, go ahead and look at the learning module section to see some of the specifics involved in this week's module for your learning. We'll see you next time.